Assalamualaikum everyone, welcome back to this channel. This is me Alia Fahid and you are on the channel of Medicare. So as you know that we have started the lectures of Form D third prop, and we have started every subject of this pharmacy level. And as you know that we have started the chapters of chemotherapy in the subject of pharmacognosy, ecology. So now in the previous lecture we have seen the principle of antimicrobial selectivity, and we have discussed the whole chapter of it in the previous video. In the next video we are going to classify all the antimicrobial agent, and this classification I have given here. But I think before discussing the next thing, I want to revise the previous chapter. So I am going to show you the previous chapter so that we both can revise itself. So this was our previous lecture in which we have discussed what is chemotherapy. Chemochemicals and treatment mean to treat our cancer diseases with these chemicals. So we use the chemicals, they can be synthetic or natural, and they have the selectively toxicity against the cells, and we use them to kill the microbes or kill the tumors without causing harm to our natural cells. So chemotherapy, they are such kind of chemicals which are going to kill or treat the microbes, and they have selectively toxicity for them, and they don't cause any kind of harm to our natural cells. And these are the chemical substances or the drugs to treat or target or to eliminate the harmful cells, and they disturb the functioning of the foreign cell. So chemotherapy we give to treat the cancer and to treat the infectious disease. To treat the cancer, we destroy or inhibit our cancerous cells. Like the types of them are like cytotoxic agents, target therapy, and hormonal therapy. Cytotoxic, in which we kill the cancer cell; targeted therapy, in which we inhibit the cancer growth; or hormonal therapy, in which we block the hormones. And chemotherapy, we also give it in the infectious disease. Not always we give the chemotherapy in the case of cancer. So we destroy or kill our all the pathogens. Types is the antimicrobial therapy, in which we treat our infection. So this was the intro of it. Then we move to the next page. So in the next page we have given what is antibiotics. So they are made from the living organism to suppress the growth of the other microorganism. Antimicrobial agents, so what is antibiotics and what is antimicrobial agent, their difference is very important. So antimicrobial, they are specialized type of chemotherapeutic drug that target or the specific microbe responsible for the infection. How to select the antimicrobial drug? First of all, you have to identify your infecting organism. To identify it, you will prepare microbial cultures of blood, urine, CSF for these fluids, and you follow some molecular techniques, which is PCR, polymerase chain reaction, and some MALDITOF technique, which is M for matrix, A for assistance, L for laser, D for desorption, I for ionization, time of light. Okay, mass spectrometry. Then you will start your empiric microbial therapy. And what was empiric microbial therapy? We have discussed it. The empiric okay, so before discussing the empiric molecular therapy, I want to tell you the Eagle effect, in which when we decrease the dose of antimicrobial agent, their effect increase. So this is called the Eagle effect. But when we increase the dose of it, no effects occur, the resistance occur. So this is called the Eagle effect of it. Then nosomial infections are those in which the decrease in the immunity of a patient who is doing the prolonged treatment in the hospital, or doing the treatment of streptococcus or tuberculosis. This is called as hospital acquired infection, because in the hospital, when you have low immunity and when you stay prolonged in the hospital, a lot of patients of streptococcus or tuberculosis came, and you can cause these diseases. Ideally, the microbial agent given to the patient when we check the stability or the stability of it. But some patient, if we delay the medication in them, they can die. So for them we start the empiric therapy. For example, the patient of neuropanic patient, in which their neutrophils are low, so they can cause any infection. Similarly, meningitis patient whose inflammation occur within the brain or spinal cord. Similarly, empiric therapy started, like for the empiric drugs we give broad spectrum antibiotics like cephalosporin, vancomycin or azithromycin. Then we send our sample to determine the microbial sustainability, in which we see the zone of inhibition. Any microbial drug whose zone of inhibition is high, it means this drug is highly sustainable. Sustainability can be determined by bactericidal concentration, MBC or MIC. Then we have seen this graph, number of bacteria, concentration, low concentration is given here. Here the time is given 8 hours or 24 hours. Then we have seen that when we give no drug, the control curve is came here. When we give bacteriostatic, then the growth of bacteria decreased, then it became a straight line because it's decreased their growth. Like linezolid is a bacteriostatic drug. When we give bactericidal, its growth rapidly decreases because it kills the bacteria. Daptomycin is its example. So bacteriostatic inhibit their growth or replication. Linezolid is its example, which is against the Staphylococcus aureus. And bactericidal kill the 99% of the bacteria. In vitro killing is greater with the bactericidal and it against the Staphylococcus pneumoniae. And the efficiency of both of them is same. Minimum inhibitory concentration, this is the lowest concentration of antimicrobial drug at which we inhibit the growth of the microbe, and minimum bactericidal concentration is the lowest concentration of antimicrobial agent at which we kill the 99% of the bacteria population. And how we calculate it, so we took a lot of test tubes and we add different concentration of antibiotics into it. Like this is the lowest concentration and gradually we increase the concentration, and this is the highest one, and we also add the microbial culture into them, and then we calculate the MBC or MIC. So first we calculate the MIC, in which we see the minimum growth inhibit. So these two have the maximum growth of bacteria. So this is a tube in which we have in which some kind of microbes die. Then after the incubation of 24 hours, we see that the lowest concentration of in which 99% of the bacteria die. So at the 64%, 100% of bacteria die. At the 32, 99% of these bacteria die. So therefore this will be the MBC. So it's mean 2 is the MIC and 32 is the MBC. So we can calculate the MBC or MIC of any microbial agent or microbial drug. Then we see the effect of site of infection, like if we have drug penetration, like if the drug has to pass through GBP, which is the blood-brain barrier, then we have to see its lipid solubility, we have to see its molecular weight, protein binding or transport or active transport. Then the patient factors are like immunocompromised patient, if we have, then we have to give broad spectrum of combination to a renal dysfunction. So we have to see that whether the drug could pass through the renal or not. Similarly, hepatic patient, so we should not give erythromycin to it because erythromycin depend upon the liver for its metabolism. Then poor penetration, so in the diabetic patient the circulation is very low. For the age, like the child, we cannot give tetracycline or quinolones to them. In the pregnancy, we cannot give tetracycline. So these kind of patient factors, so we have to remember them, and then we have to give the patient the drug. Safety agent penicillin is the most safe among them, but it has some disadvantages, but still it considered as the least toxic or most safest among them. Cost of the therapy should be low. Next thing is our route of administration. Oral route is the best for the mild infection, but if we have serious infection, then give the IV route. Post antibiotic effect are those in which persistent suppression of the antimicrobial growth after the antibiotic elimination out of the body. For example, aminoglycosides or fluoroquinolones show these kind of reactions. Chemotherapeutic spectra, narrow spectrum, extended or broad spectrum. Narrow, in which we act as a single eliminated group of act on the single group of the microbes. Okay, so it gives the specific pathogen. Like isozonate is example which kill the microtuberculi. Extended is effective against the gram positive or gram negative like amoxicillin. So I am revising the previous lecture. So broad spectrum, they are used for killing all the bacteria like tetracycline and furos. They kill all the types of microbes. Synergistic are those in which two antibiotics work together like beta-lactam and aminoglycosides. If the two bactericidal work together, this is called synergistic. If two bacteriostatic work together, this is called additive effect. If one bacteriostatic and one bactericidal act together, they give antagonist effect. There are disadvantages synergistic, like if we give bacteriostatic or bactericidal drug like the tetracycline or penicillin or cephalosporin, tetracycline interfere with them. Resistance occur between the bacteria like the gram negative develop the resistance against the vancomycin. Genetic alteration can occur. Alteration in target site decrease the penetration, increase the efflux of drug, and increase the inactivating enzymes. These kind of things can occur. Next is determination of rational dosing. Rational dosing of antimicrobial agent depend upon the pharmacodynamic, in which relation of drug concentration to its effect occur, and pharmacokinetics. Frequency of dose depend upon the concentration dependent killing, time dependent killing, and the post antibiotic effect. Concentration dependent killing, in which as the concentration increase, the rate of bacteria killing is also increases, like this is shown here. So as we increase the concentration from 4 to 64, from 4 to 64, the killing of bacteria also increase. In the 4 hours we have killed all the bacteria, but when we have 4 MIC, we kill all the bacteria in the 8 hours. Examples of the drugs are given here, which should be given once per dose, because when we increase their concentration, the bacteria killing is also increased here. Time dependent concentration killing, in which some drugs, when their concentration increase from 4 to 64, for the rate of bacteria killing does not significantly increase. These drug efficiency is predicted by determining the percentage of time. These kind of drugs in which concentration of drug remains in the blood, these are the examples of these drugs. Examples of cephalosporin, percentage of blood in the blood is 50 or 60. Like piperacin, this is a drug whose time percentage is calculated out, whose rate of bacteria killing doesn't increase when we increase the dose from 4 to 64. For prophylactically, we use the bacteria before any disease, before the spectroscopical infection, before the dental procedure, before the surgery, before the tuberculosis or meningitis. Similarly, these secondary bacterial infections, we give the prophylactic use of antibiotics. Complication is allergy or hypersensitivity can be occur with the penicillin. Red man disorders can occur. Stevens-Jones syndrome can occur. Direct toxicity can occur. Photosensitivity. Autotoxicity occurs with the aminoglycoside. Hearing impairment. Okay. Toxic for mitochondria is chloramphenol. Fluoroquinones are toxic for tendons and cartilage. Tetracycline are toxic for our bones. Sorry for not saying you. Super infections due to broad spectrum combination therapy we give disturb our normal flora. Okay, so super infection can occur due to this. Okay, so after that we see the classification of antimicrobial agent on the base of their mechanism of action. They are divided into these types: Salvol inhibitor, protein synthesis inhibitor, nucleic acid inhibitor, inhibitors of metabolism, inhibitors of membrane function. Salvol inhibitor, which inhibits salvol like penicillin, cephalosporin or vancomycin. These are the 3 important drugs that came under it. Classification on the base of chemical structure, like beta-lactamins are those which contain the beta rings. Sulfonamides, sulfametazole, drug containing diaminopyridine like this drug. fluoroquinolones containing drugs, aminoglycoside containing drugs, nitroimidazole containing drug, tetracycline containing drug, macrolide containing drugs are here, nitrofuranons containing drug are here, polypeptide containing drug are here, polyethylene antibiotic containing drugs are here. So we will classify or see the detail of it. Then on the basis of their therapeutic uses, antibacterial agents, antifungal agents, antiviral agent, antiprotozoal agent, helminthic agents are given here. On the basis of spectrum of activity, narrow spectrum like effective against a specific group of bacteria like penicillin G is for effective for gram positive, or the erythromycin is also for the gram positive one. Broad spectrum which are effective against all the types of the bacteria, gram positive, gram negative, like ciprofloxacin, tetracycline or amoxicillin. Types of action: bacteriostatic or cidal. Static like tetracycline, sulfonamide, doxylidomycin. Cidal is for penicillin, cephalosporin or aminoglycoside. Nature of antibiotics: like natural antibiotics are like penicillin is derived from Penicillium notatum. एरिथ्रोमाइसिन इज ड्राइव फ्रॉम बैक्टीरिया. सिंथेटिक आर लाइक सल्फोनामाइड, सल्फामेथाजोल आ जाते हैं. एरिथ्रोमाइसिन, फ्लोरोक्विनोन्स, दीज आर सिंथेटिक वंस. Next are the factors influencing the choice of antibiotics, like organism related factors like identify the pathogen or sensitivity pathogen. Some host related factors like age, renal function, hepatitis, hepatic functions, allergy or pH. Some drug related like spectrum of activity, action of kinetics, drug interaction or relative toxicity. Classification of antibiotics based on the fetal safety like category A, B, C, D and X. A has no risk for the fetus like penicillin or cephalosporin. Category B has no risk for human but toxic for the animals like erythromycin or amoxicillin. Category C is animal studies show fetal risk but no controlled human studies, so tetracycline or chloramphenol they have animal risk or fetal risk. Then the category D is have the human fetal risk and also have more benefit, less risk like fluoroquinolones. And category X has more risk, less benefit like isotretinoin. Bacterial sensitivity testing method like diffusion methods, antibiotics. These are placed on the agar plate inoculated with the bacteria. This is a diffusion method. In the tube dilution method, we check the MBC or MBIC, and how we check it I have told to you. So this was all about our today's lecture. I hope that you like this video. If you like it, then please subscribe to my channel, like my videos, and also press the bell icon so that you can get the notification of all the video which I have uploaded. Thank you so much. Meet you soon in the next lecture with the next topic. Take care. Allah Hafiz.